Before taking Xpovio, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once or twice a week. Swallow the tablets whole with water, and do not break, chew, crush, or split the tablets. It's important to drink plenty of fluids during treatment, unless directed otherwise by your doctor. If you vomit after taking a dose, do not take an extra dose. Instead, take the next dose at the regular time. The dosage is based on your medical condition, lab tests, and response to treatment. To get the most benefit from Xpovio, use it regularly and take it on the same days of the week and at the same time each day. It may be helpful to mark the days on your calendar when you need to take the medication. It's important not to increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of serious side effects will increase. Lastly, since this drug can harm an unborn baby, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. Some common side effects of Xpovio may include dizziness, tiredness, diarrhea, weight loss, nausea, vomiting, or loss of appetite. Your doctor may prescribe medication to help with nausea and vomiting, and eating small meals or limiting activity may also help. If you experience severe vomiting or diarrhea that doesn't stop, contact your doctor as it may lead to dehydration. Xpovio may also cause serious side effects such as low levels of blood cells, which can result in anemia, decreased ability to fight infections, or easy bruising and bleeding. It can also decrease bone marrow function. If you notice symptoms like unusual tiredness, pale skin, or signs of infection, contact your doctor right away. In rare cases, Xpovio can cause a serious allergic reaction. If you experience symptoms like rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember, this is not a complete list of possible side effects, so if you experience any unusual symptoms, contact your doctor or pharmacist. And as always, if you have concerns about any side effects, don't hesitate to reach out to your doctor. Before starting Xpovio, make sure to inform your doctor if you have any allergies or medical history of cataracts. This medication can increase your risk of getting infections or making current infections worse, so it's important to stay away from people with contagious illnesses. Also, be cautious with sharp objects and avoid contact sports to lower the chance of getting cut, bruised, or injured. Xpovio can make you dizzy, so it's best to avoid alcohol or marijuana while taking this medication. It's important to talk to your doctor before using marijuana. If you are planning to have surgery, make sure to inform your doctor about all the products you are using. Pregnant women or those who may become pregnant should not handle this medication or breathe in the dust from the tablets, as it may harm an unborn baby. It's important to discuss reliable forms of birth control with your doctor during treatment and for 1 week after the last dose. If you become pregnant while taking Xpovio, talk to your doctor right away about the risks and benefits of this medication. Breastfeeding is not recommended while using this drug and for 1 week after stopping treatment, so consult your doctor before breastfeeding. When taking Xpovio, it's important to be aware of potential drug interactions that could alter how the medication works or increase the risk of serious side effects. It's crucial to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your healthcare provider. It's essential to follow your doctor's guidance and not make any changes to your medication dosage without their approval. This will help ensure the safe and effective use of Xpovio. If someone takes too much Xpovio and has severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It's important not to share Xpovio with others. Before starting this medication, it's essential to undergo lab and/or medical tests, such as complete blood count, sodium levels in the blood, and body weight, and to continue with these tests while taking the medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget to take a dose of Xpovio 100 mg per week, 20 mg X5, tablet, just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. You should store Xpovio 100 mg per week, 20 mg X5, tablet Antineoplastic-Selective inhibitors of nuclear export, (SINE), in the refrigerator or at room temperature, but make sure it's away from light and moisture. Do not freeze it and keep it out of the bathroom. It's important to keep all medications away from children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.